We just want to say welcome to our Impact members, Impact guests tonight, and a lot of representation from our nonprofits. And this is the first educational series for Impact 100. I'm Lori Missick, and tonight is, as I said, the first of a 4-part series where we really want to discuss the needs in Monmouth County. So we're going to be kicking off tonight highlighting the Monmouth Acts program with County Commissioner, Deputy Director Susan Kiley, and then specifically talk about a pressing need that we all know about, which is hunger. And we're going to do that with 2 of our past Impact grantees, Fulfill, which was a grantee just last year in 2020, and St. Mark's Center for Community Renewal, which was a grantee in 2019. And they're going to share some of their frontline experiences. Before we move forward, I just want to take a quick second to share a little bit about Impact 100 with those of you that may not be completely familiar with us. Very simply put, we're women of different ages and backgrounds who combined our charitable dollars, experience, and energy to make a tangible difference in our area. So Impact Jersey Coast is part of a growing international movement. There's about 55, probably more now, impacts globally, and 4 impacts right here in New Jersey. And so what's nice is Impact Jersey Coast is just looking to make a difference right here in Monmouth County. So since our inception is 2015, and we've awarded $2 million in 18 years. To 18 nonprofits. And this is going to be our 7th year. And so just quickly, the impact model, if you're not familiar with it, is, again, we are women that pool our donations together. Each woman donates $1,100. Our local nonprofits will then submit applications for a high impact grant. We have committees that review the applications, perform site visits, and bring finalists to our entire membership. And then our finalists actually will present and vote in a live meeting, which we just had. So how this whole process looks, if we just look at, 2021, we had 430 women. So we had $430,000 to award. All our awards are 100,000 or more. So we divided that by 4, and we were getting ready to award 4 grants of 107,500. We had approximately 52 nonprofits submit applications. And this is amazing. We had 96 volunteers that reviewed the applications and performed the site visits and ultimately brought 5 finalists to our annual meeting, which is always held in November, where we hear the 5 projects and vote live and award the money, which was really, really exciting. We just did that virtually on November 17th. So I wanted to share just a little bit about Impact. But what we really want to do tonight is talk more about our community and really focus tonight on not only hunger, but to show us a little bit more about the Monmouth Acts program. So when Mary Riley on our grants leadership team showed us the Monmouth Acts program, we just knew that this is something we absolutely wanted to share with our membership. And that's kind of how our 4-part membership education series was born. So we thought, who better to tell the story about this program but the commissioner herself. So we're so excited that she's here with us tonight. So I'm excited to introduce Commissioner Susan Kiley to talk about Monmouth Acts and our community and the pressing needs. She's had a very successful 30-year career in healthcare industry before entering the political arena. She's an executive board member of the RAIN Foundation and Breast Intentions, which are 2 great local charities. On the executive board for Modern Day Prep and the Modern Day Women's Advisory Board. But last but not least, she has 5 children, 11 grandchildren, I think 12 on the way, so she can correct me. But welcome so much, Commissioner Kiley. We're excited to have you here tonight.
Thank you very much. And actually, it's 12 and 13's on the way.
Oh, that's fantastic.
I believe it. I really. First of all, thank you very much for the explanation of what Impact 100 is, and thank you for everything that you guys are doing to help our community. I think it's fabulous. A couple of years back, we did an assessment of the needs in the community, and from that was born Monmouth Acts. We discovered that there were needs in 8 different areas, none of which are going to be unfamiliar to you. It was early childhood success, positive youth development, aging, homelessness, transportation, financial needs, financial empowerment, then mental health and addiction services, and communication. Let me start with communication. My biggest frustration in Monmouth County was that I learned about all of these fantastic services that we had out in our community, and nobody knew they existed. You know, I would have a mom of an addict come to me and say, you know, you guys can't help me. There's nothing out there. My son needs help. There's no work. And it would make me crazy because we have a lot of organizations. So we created Monmouth Acts, which is a private-public partnership between the county and the providers inside of the different communities of services. This way, we're talking to each other all the time. Everyone knows what everyone's doing, so there's no wrong door to enter the system. And for example, 180 Turning Lives is one of our members. If they have a woman that they're trying to help who not only needs housing, but she's hungry and she needs child services, now they can direct her to all of those services from their facility versus, oh, well, you got to call that one or you got to call that one. We're all one big network helping our community as best we can. We have a lot of great organizations that are part of Monmouth Acts, and we refer to each other as many times as we can. The other thing that happens is that we are creating communication avenues, and COVID really put an impact on our residents in their financial situation, in their health situation. You know, I mean, thank God we had Monmouth Acts at the time because we already had a platform and we were ready to get going to help people. To that end, the Mental Health Association volunteered people. A couple of the professionals that had retired came back to man a helpline. So we had a mental health line up right away. We had a resource guide that was already created so the seniors knew where to go if they needed things, if they wanted someone to shop for them or get them food or prescriptions, call this number. So everything fell into place very quickly because of the network we had. And it's been very, very rewarding. Our next initiative is, because we're still not reaching as many people as we want, our next initiative is to take this organization out in the community and bring the help closer and closer to our residents. So we're looking at partnerships with different organizations. For example, Brookdale Community College. Now, they have campuses in multiple places. If we could have access to their students by partnering with them, that would get closer to the people in need. So we're always looking at how can we make Monmouth Acts a little better? How can we connect more with our residents? It's a great program. It's very rewarding. I don't want to talk long.
No, that's great. You know, I would love to take a quick step back and talk a little bit about Monmouth County as a whole. I think that the needs assessment creates some great information on maybe our population, our socioeconomic, status, or just the need for services would be really helpful.
Sure. We have 660,000 people in Monmouth County. Most people don't realize that. And we are a very wealthy county, but we are not without needs. We are not without an underserved population that continue to need the things that we bring forward. Some of the biggest things we're seeing right now, homeless. We work very closely with Fulfill because of people that have food insecurities, especially now during COVID. We're also working with small business. These are the things that have come up recently that have been real issues. Small businesses, are done. We created a program to give them a lot of money towards their businesses to stay alive as we went through COVID. There's money that we gave to 501c3s. And the businesses received, I think it was $43 million, and they were in $10,000 increments. What else? Homelessness is a huge issue now. And I was just on a call today with the Homeless Coalition. We're working with hotels to be able to have access to rooms for people that are homeless. We're also working with churches. We have a code program that's right now. So if someone is homeless, and like tonight is a code blue night, where it gets below 30 degrees, there's a list of places they can go to warm up, and to talk to people and be able to stay safe. Uh, is huge right now because everyone's having struggles to pay their bills, to find out what grants and resources are available. We're working with people that need to pay their rents and landlords that need to collect their rents. We have this ERAP program. There's lots of money there. We just got to get people to reach out and ask for it.
One quick question. How do you keep the needs assessment up to date? Is it something that was just done in 2020, and how does it evolve?
Well, that's a great question. Right now we feel a good understanding of the needs within the community, but we're always talking about how we can find out more. And I think we're actually getting ready to do another assessment. Because you don't want to go too long. I mean, when we did our first assessment, before our last assessment in 2020, vaping was something nobody had ever heard of. So I only use that because it's a good example of how things evolve, and all of a sudden you need training and guidance in an area that wasn't even on the radar before. So we recognize the need to always be looking and checking and modifying what the needs are. So I think there's another assessment coming soon.
And then just talking about collaboration, I think that's a big part of Impact. And obviously we're trying to collaborate with as many nonprofits, and they collaborate together to apply to Impact. Does your group reach out to get more nonprofits to obviously give more services? Do you feel like most of the nonprofits, or do you think that's growing?
We're always growing because there are so many nonprofits out there that you can't always capture all of them. But I mean, we work with Ladison, HabCorp, the Mental Health Association of Monmouth County, Monmouth Cares, Preferred Behavioral Health. We work with the SCAN network. We work with United Way, and that's only a small sampling of the list. It's pretty extensive. And again, we meet on a regular basis lately on Zoom, and just try to make sure that everybody's in sync. We know what each other is doing, and we know, where to go if we need some help for a resident.
That's great. Anything else you think about the Monmouth Acts in general? I mean, all of us are Monmouth County residents wanting to help. Obviously, Impact is working in a different way. Anything specifically we can do as residents to help?
The communication is our biggest challenge, just making sure people know that it exists and that there's a lot of help out there if they reach out for it. The other thing I would say is I'll give you the number. We have a website for Monmouth Acts, and I'll give you the phone number for what we call a warm line. If people are anxious to get some help, but they don't know how to use a computer, for example, they can call this number and talk to a live person and get some direction on where they want to go. So I think that's probably a good idea to give you that. And that number is 732-683-8959. And anyone can call. If you don't get a person on the line, you'll get a message and you'll leave your name and they'll get back to you. But it's just, as I said, it's a great way of doing business with tremendous organizations and making sure there's no wrong door when someone reaches out for help.
Absolutely. And any other stories you can share with us specifically about, a specific need or something new or recently that happened? And, as you mentioned, COVID's been a very tough time across the world. Anything specific here in Monmouth County?
Well, sure. I'll give you a couple. Dr. David Stout was on our assessment team. And when we went to Brookdale, we found out that there were a lot of students that were sleeping in their cars because they wanted to go to college, but they didn't know where to live. They didn't have any money, et cetera. So we put a social services office on campus. And we've been able to help so many of those students, but not only that, now their professors and their staff are coming to us for help as well. So that was a real home run. The other thing we discovered at Brookdale was that the nursing program there for new nurses did not have a program on how to deal with an addict when they present, in full addiction. What do we do? How do we approach them? What's the right thing and the wrong thing to say? So we were able to put together, based on the membership we have, a program for the nurses, which is now being taught in the school to help them better react, to an addict that comes in and needs help, but is really, wired out at the time. Trying to think what else. We put patient advocates in place. We got a grant for a patient advocate for the moms and babies. Many of these moms are underprivileged. They don't know anything about raising a child. They may have other issues of their own. And these advocates can go out into the community and work with them understand, take care of their child, help. We've done diaper drives as a result of learning that people really are in need of diapers. Women are hugely in need of feminine hygiene products. And so we're always trying to promote that with women's groups, tell them, if you want to start a drive, we can get it to the right people. But we've had a lot of really good successes. We've had a lot of places where people we've helped have turned around and helped others. And that's just so rewarding because our network continues to grow.
Absolutely. And I know there was one quick question. How could a nonprofit connect to you for services?
Sure. Well, you could call into that number and just tell them what you're looking for, and they'll send you to somebody within the department. I can give you my office number too. I can even put it in the chat if you want. And then that will reach out to me. Nicole Policia is my confidential aide, and she does a lot of the constituent relationship things, and she will guide people in the right direction. She's excellent. And her number, I'll give you her number too, because she really does a fantastic job.
Excellent. Thank you so much, Commissioner.
My pleasure.
We're gonna keep going. We'll probably come back, so don't go too far. But one thing we really wanted to do is talk about some of the specific needs that came out of the needs assessment. And one is hunger. And I think that is something that everybody here knows about and sees. And better way to do it, the front lines of two of our past grantees. So we're going to start right now with Fulfill. We have Linda Kellner, who is the Director of Development and External Relationships for Fulfill. And so I want to welcome Linda and have her really just start by talking about her role in addressing hunger in Monmouth County and maybe just what inspires you to be a part of this.
Good evening, everyone, and thank you, Lori, and everyone from Impact. As Lori had shared, I am the Director of Development and External Relations, and in that role, I have the responsibility of leading a team that raises the funds needed to feed the 215,000 people we currently serve at the Jersey Shore. About half that number, a little more than 100,000, are Monmouth County residents. Fulfill is 87% donor funded. So the food that we distribute to our nearly 300 feeding partners, and that's pantries and soup kitchens like St. Mark's. It is shelters, senior centers, and other organizations, relies on the fundraising, as do the many programs that Fulfill runs. And we raise funds through partnerships, donor relations, identifying grant opportunities, and also communicating our needs to the public. As the Commissioner had shared, it's so critically important to make people aware of not only what you do to serve the community, but what's needed in order for you to carry out your mission and ensure that you're there for those who are in need. What inspires me every day? Honestly, it is what gets me into the office. I have pictures in my office of the children that we serve. That's not stock photo. They are kids that are actually receiving the food, that we provide through our network. And seeing and meeting a lot of the people we serve who are in need, many of whom that once they're back on their feet are coming to us to volunteer or donate. I'm also blown away by the kindness of the generous people who give to us. Some it's thousands of dollars, and some it's the change in their pockets. We are grateful for all of it, because as you all so well know, it is the collective impact of all of that support together that lets us, do so much. And I'm inspired by my colleagues and our board of trustees and the volunteers that go above and beyond every single day to make a difference in the lives of so many folks.
That's excellent. It is amazing, right? It takes a village to try to put everything together. One thing that I thought was interesting in the Monmouth Acts, it highlighted that food insecurity continues to obviously be a concern. And specifically in Monmouth County, right, we have a high cost of living. So many families right now are kind of making that tough choice. Do we pay the rent? Do we pay the utilities? And talking about all the different costs. So about 35% of the people that responded to the survey said that food was a priority. Mentioned some numbers, but how many people do you think experience food insecurity, in New Jersey or even in Monmouth County? I know you serve about 100,000, but do you have any numbers there percent-wise?
Well, currently in the state of New Jersey, those who are food insecure is estimated to be at 1.1 million people. So that's 1 in 8 people in New Jersey right now are food insecure. In Monmouth County, I had shared we are currently serving a little over 100,000 people. So that's 1 in 6 of our residents in Monmouth County is food insecure. Prior to the pandemic, that number was 1 in 10. Fulfill has seen a 40% increase in the demand for food since the start of the pandemic. We previously had been serving about 136,000 people, including 50,000 children. Today it's 215,000 people, including 70,000 children. And it really is it's a pretty even split between the two counties we serve, Monmouth and Ocean. We've seen a 40% increase in the demand for food, although a lot of studies and the projections that we've seen have said that it could go as high as 56% in New Jersey, which is above the national average. So the pandemic has clearly impacted so many people, and much of it is early on with so much of our local economy being dependent upon restaurant and the hospitality industries. We have seen people coming to our door in the last 2 years who never in a million years thought they would need to depend or rely upon a food bank for their next meal.
Absolutely. And something that the commissioner highlighted was transportation, right? Just getting these needs to our residents. So, how do you coordinate with the county or other providers? And, what are some of those barriers to get food to our residents?
So transportation very, very much is a challenge, especially for our clients and those we are serving. For example, that's one reason why our member pantries are so critically important, because they are the boots on the ground in the community, helping to get the food we provide them to those who need it. Fulfill also has mobile pantries that are going out into the communities, into areas where there may not be a local pantry to bring the food to people who are hungry. And we also have a benefits bus, which again is going out into pockets of the community where transportation is particularly difficult for people. And in addition to having emergency food on that bus for folks, they are signing people up for food stamps and affordable health care. So it's bringing some of those basic critical services right to where people live. Fulfill has had some conversations with Commissioner about transportation, and this is where it is the collaboration and working collectively that ultimately will help us get in a better place with regard to transportation for people. But that is a challenge. Another challenge we see is the stigma of being hungry and people being embarrassed and not wanting to say anything or to ask for help. Just a few months back, we had a call from a senior in a local town in Monmouth County who called us in tears, not knowing where to turn, and the only thing she had in her house was seltzer. Didn't have the ability to get out of her home. We were able to, pack up lots of food and lots of good nutritious food and get that delivered to her. And we're feeding, her every single day, since that phone call. But there is a stigma, and just at the start of the pandemic, we launched a toll-free number where someone would text find food or comida. If you're Spanish speaking, it prompts you to put in your zip code, and then we'll provide you with the location of every pantry and soup kitchen within 10 miles of where you are. So it's very much giving folks, the information of where they can get food in a stigma-free manner. It's literally in the palm of their hands.
Yeah, going back to that communication that Commissioner said is so important. My last question, Linda, is if you could just talk briefly about the Impact 100 grant and maybe how that aided to the hunger in Monmouth County.
Oh my goodness, yes. Thank you all so very, very much. The grant we received from Impact 100 last year was specific to primarily to our children's backpack program. Our backpack program provides weekend food for children who receive government-funded breakfast and lunch in school. So they're eating Monday through Friday, but what happens when they go home over the weekend? So Friday afternoon, whether it's a teacher, guidance counselor, teacher's aide or school nurse, a backpack filled with 2 days worth of food is being discreetly put into the child's backpack. And prior to receiving the Impact 100 grant, we had 200 kids on that waiting list. And again, we're primarily donor funded. So, limited at times as to what we can do. And this grant allowed us to take those kids off the waiting list. So they are today receiving food for Saturday and Sundays. And we've been able to enhance, the food that's going in there, because if this child is hungry at home over the weekend, likely there are other family members who are also hungry.
Thank you so much, Linda, for being here, for all that you do, and obviously fulfill the amazing work that they do. Our third speaker tonight is Deacon Rose, who's the director at St. Mark's Center for Community Renewal, which was a 2019 grantee. So we want to welcome Deacon Rose and really just start off with the same question. Tell us about your role in addressing hunger in Monmouth County and what inspires you to be a part of it.
Great, and thank you for inviting me to be a part of this meeting tonight. St. Mark's has been serving people with food insecurities since the 70s, so for quite a while. It started out as just a few elderly getting together for breakfast or lunch. It's grown, and it's always been a place that is safe and welcoming for everybody. Whether you're elderly, homeless, drug addicted. Keansburg is this interesting little town in the middle of Monmouth County that has a per capita income about half of what Middletown and Hazlet right around has. And so, there's a lot of people in this area that need help. And what inspires me is being able to not only provide that help, but also work with all the other great people that want to help. And so we meet people from all walks of life. And not only in our guests, but also in our volunteers, and watching how the volunteers can change, as well as how our guests can change and making a difference in all their lives. One of the great things about St. Mark's being such a small and nimble organization, we've had to go through some major changes. Superstorm Sandy was a major change. There was gentrification happening in Asbury and Long Branch that impacted Keansburg, and now with the pandemic. And having the ability to do things with our volunteers and move things around and survive and flourish and help others to survive and flourish really has been what's very, very inspiring. We have some of our teenagers that they come back even after their hours are done, for National Honor Society or whatever. I have one young gentleman that on his weekends off, he's hanging out here helping us to give out food. And so it's just responding to the community's needs and knowing that, the other hat that I wear here is, I'm the vicar of this church. And if, in order to feed people's minds and their souls and their spirits, their bellies have to be filled first. And, and not forgetting that really, really matters, is making sure that people have enough to eat, dovetailing on our previous speaker, we've had people showing up here that used to help at different food banks, and just, and the stigma and the, embarrassment, and just, nope, everybody's welcome. And some days you can't tell guests from volunteers, and that's really the way we want it to be, is we're all one. We're all one.
Yeah, that's a great point. Thinking about just how many people you serve, or if you know some food insecurity numbers, maybe just overall for St. Mark's, and then specifically how you work with other organizations like Fulfill or the county.
Yeah, we've been working with Fulfill for many, many years, even before they were Fulfill, when they were Monmouth Ocean Food Bank. And so they've been a major source of our food itself. And, likewise, I think we have a great partnership with Fulfill. When they started their seafood gleaning program, where they were taking, what otherwise would have been thrown away, because it's not marketable fish, but totally edible, we were getting a lot of that food here and able to use it, at the soup kitchen, or give it to our guests who love the idea of getting fresh food. We currently serve 60 to 80 meals every single day of the year. We were closed one day last year, and it was due to snow, not due to the pandemic. And, in early parts of the pandemic, Fulfill was able to partner with some restaurants that helped us with that. But we were very blessed by, this impact grant to have this space to start to work here and prepare meals as well. And the numbers, 60 to 80 meals right now, it was as high as 125 to 150 during the pandemic every single day. And, and then we have pantry 2 days a week. And we have, 800 families registered that have seen us in the last couple of years. 800 families in a town that's 10,000. And so I know we get people from, the surrounding areas, but, we have a lot of people. We serve about 850, recipients, which is, if you come 4 times, you count as 4, during the month. But about 850 people a month are coming through and getting, so the need is there. And, the need for additional things beyond food, like the diapers, like the feminine products, like, shampoos and, toilet paper and things like that. Those are starting to come on Fulfill's, shopping list, which has been great for our guests as well. But, the need is starting to come a little bit back down with the pandemic, but I think it's short-lived. And so we just are constantly looking at what's next, what can we do next? We were fortunate that because we were closed down, one of the things we could offer to some of the kids that were in virtual learning is they really didn't always have a place that was comfortable where they could do their work. And we could allow maybe 5 or 6 girls. We ran a STEM program here, and we could allow, 5 or 6 girls to do some virtual teaching here and virtual learning, to get them, out of the house and also get some virtual learning. And because we weren't serving lunch, we did a 4-week camp over the summer, which was just, a phenomenally new experience. Never would have imagined that we would be venturing out into academic camps as well. But, so those are some of the things. And we partner very closely with Affordable Housing Alliance in trying to work with them on, different ways of serving, Keansburg, which is a big source of need.
Absolutely. Well, those are great ways to pivot. You never thought, right, that you'd be teaching.
You never know. You never know.
Yep. And lastly, I know you mentioned talking about space, but talk a little bit about the Impact 100 grant and, how that helped you address hunger.
Oh, yes. So our original grant was just, we were not just, but we were going to expand our kitchen, which was very, very tiny, and modernize it. Literally, the stove was from the 70s. And so we got the expansion finished. We got all of the major appliances in. We were able to cook one meal before the governor's shutdown. And then we were shut down for several months, which then made us think, okay, now what do we do? You know, we weren't completely finished with all the work we had planned, but we couldn't have contractors inside. Our volunteer group shrunk down to, you know, just a handful of people, you know, that were part of our bubble. And so we took that pivot and we started looking at the outside space. We are blessed with space here. And so we employed a few of the you know, folks that are guests that, you know, the working poor to be able to come in and help us with things like staining the decks, painting the foundations, things that weren't necessarily stuff that we had thought of as part of this grant, and were things that sometimes we get volunteers to do. But it gave us a great opportunity in working with, you know, the leadership of Impact and talking about how we would, you know, potentially be changing things a little bit to make a focus on, right now we need space outside that people can eat, you know, and you know, and so it's been phenomenal. And then once we were able to open up again, you know, we had to revisit our HVAC because, you know, of course, we had to think about all that. But then once we were able to start being inside again, this new amount of space meant we could have more people in the kitchen comfortably and not on top of one another. So it's just changed really the way that we can operate here, the number of people we can serve and how we serve them. And it's been a blessing beyond measure. You know, what we thought was going to, you know, be done got done and then some. You know, it's just been, you know, my grandmother used to always say, when you've got a goose, you'll get a goose. And now I understand, as we had some money to put forward, other things came into line to help us to really move things along.
That's so wonderful. Thank you so much for sharing your story, and thank you to Linda and Commissioner Kylie. What I want to do now is, if you have a question, please feel free to put it in the chat. We're going to get to as many as we can. I'm just going to kind of finish things up, because what I really want to talk a little bit about is impact as a grant maker, because this obviously is a big part of what we do. And so I'm going to go back and share one more slide. So I mentioned a little bit about the impact model, and I think one of the most important things are two things make us a little bit unique. You know, just harnessing the power of that collective giving and giving large grants amount. They're truly transformational. As I said earlier, you know, 100,000 is the dollar amount that we divide by to give the grants. And that's the power, you know, of the multiplier. I look at myself, for instance, last year, my $1,000 was $430,000. And it's just been incredible to be a part of that. The second thing I think that makes us different is we aim to fund specific projects or programs. And so when our nonprofits apply to us for the grant, they really have to think about a project or a program that is going to target an underserved population, highlight an unmet need in our community, which obviously goes right in sync with what we're talking about today, or have a high impact on its beneficiaries. And I think that's very unique in a lot of the models. So right now we're so excited because we're in our membership season, and for Impact, everything starts over. So we were so blessed to have 430 women last year. And we actually started our membership drive in October, and on March 15th is when it will close. And if you're a member, please renew for next year. If you're a guest and you'd love to join, we are so happy to have anybody that's interested. There's a few ways you can join. Here's our website. You can obviously donate the $1,100, which has to be done before March 15th, via credit card, check, bank transfer. We have donor advised funds, and we have employers that want to pay for their employees. So that's another way. We also have a new installments plan. If you were looking to start donating today, or obviously before December 15th, it would be 4 payments of $285. And last but not least, we have a scholarship program, and that will be up on our website in January. And we give out scholarships every year, which is an incredible program. And last, I just want to make a quick plug for our next 3 series. As I said earlier, we really want to educate our members. We want to collaborate more with nonprofits and the county. And this was a great start, or our first session. We have a second session coming up on January 11th. That's going to talk a little bit more about housing. And we're going to be talking with HABCOR and Covenant House. Session 3 will be on January 25th, talking about substance abuse with CFC Loud and Clear. And 4 will be February 1st, talking a little bit more about behavioral health services for adults with 180 Turning Lives Around and Mental Health Association. And you can register on our website for those. All right, so what I'm going to do now is see if we have some questions, and I'll just probably ask them directly. Let's see here, as my chat is blowing up. I love this. Let's talk a little bit about the holidays coming up. If someone wants to talk about how to volunteer, maybe donating money, goods. I feel like I heard a lot about feminine products and toiletries and things like that. Do we want to start with Linda?
Sure. Yes, there are lots of volunteer opportunities at Fulfill. We could not do all that we do without our volunteers. If you're interested in volunteering, you can go on our website, fulfillnj.org, and can sign up there, and our community engagement specialist will reach out. There are also opportunities to do food drives, and there's been a lot of conversation about diaper drives or drives for feminine hygiene products. Believe it or not, one reason there is such a need among those we serve for diapers and feminine hygiene products is that you cannot use food stamps to buy either one of those. They are not considered essential items, if you can believe that. So Fulfill we've been doing as much as we can, and this year we've been very blessed to have secured some pretty sizable diaper grants, if you will. And Deacon Rose, that's one reason you have seen them on the shopping list this year.
Wow, I didn't know that. That's amazing. Deacon Rose, how about yourself?
We also, love to get donations of, the things that you can't buy with food stamps. The best way is to bring them here. We're at 247 Carr Avenue and in Keensburg. Volunteer wise, we need help on certain days at certain times, but not being fully open, we're not quite yet ready to do a mass call of volunteers. So it's been very, very few and far between. A lot of our volunteers are, of an advanced years, and they want to kind of keep their, safety and stuff, and but the pantry, on Saturdays is a big draw for volunteers, and that folks get here as early as 7:30 in the morning and to meet the truck. So
Great, thank you. All right, our next one is for the commissioner. What surprises did Monmouth County encounter maybe during the onset of COVID-19, and any measures that the county took and put into practice to address those needs?
Oh, God, that's a great question. When this started out, I remember saying it, and if somebody brought it up when I was running for office as they said, this was not even as bad as flu. When this started out, that's what everyone thought, that this too shall pass, right? And then it continued to get worse and worse, and the numbers got high. The challenges we had were getting the right amount of testing equipment and getting the right amount of and that kind of stuff from the state, because we were trying to set up appointments fast and furious, but then when you don't get the product, you look pretty bad if you can't be able to give a vaccine when you scheduled 300 people and you only got 100. Or we had an instance where, there was a major shutdown in transportation and we didn't get any for 2 days. So those were the kinds of things that we struggled with. What we started right away, Director Arnone and I did press conferences as often as we could, so that we could inform people of what the numbers were, where the clinics were. We did free testing, free vaccines, and where those locations were. And then we also tried to help them by just giving them general precautions to take so that, and they're standard. I think I said it at every single press conference. Wash your hands, social distance, wear your mask. I was starting to feel like they were looking at me like going, yada, yada, yada. But it was really important to keep saying it because people don't realize that those were the things that were going to prevent the spread, just general stuff. And we should all be doing it every day. But I think the biggest challenges were being able to serve as fast as we wanted to because we didn't have the product when we needed it. And that smoothed out too. That got much, much better.
And just to follow up, we're lucky enough to have one of our impact members from Essex County on. We do a lot of collaboration with the different impacts. And they were wondering, how do they find out if there's a similar organization in their county? Is this something that just Monmouth County did?
I'm happy and not so happy, but Monmouth County is the first one that's ever done this kind of a collaborative, Monmouth Acts program. And if it were up to me, invite me because I'll help you get it set up. It's been wildly successful for us in terms of, as I said, opening up the doors for people that don't even realize there are services there. So anyone that's interested, I would love to meet with and help you get started.
I'm just trying to get through some of these. I'll probably take one or two more. Yeah, someone was just specifically saying that not all food pantries take things like Depends and different hygiene products. So it's good to know that Fulfill does.
I just want to remember this. I
Yes.
promised my office number and I'd like to give that to you because I couldn't type it in the chat myself. It's 848-444-5270.
And last question came from one of our members that was asking about assisting citizens with housing. Specifically, I believe she works with a vulnerable community, which is people that are released from correctional facilities that are now looking for employment. Do you do any type of housing assistance there?
That's another good question. We've been working with a program to help people leaving to re-enter society, and that's pretty inclusive. We're trying to help them to find a job, find a place to live, and that's all a program that's under former Governor McGreevey. And we've partnered, the sheriff in Monmouth County has partnered with him. The name of the program is escaping me. I apologize for that. But it's great. And it really helps them re-enter society in a positive way and have all their needs met.
Excellent. Well, I would like to thank everyone for their patience, apologize for our rocky start, and appreciate everyone with the questions and obviously all of our speakers. I think this was such a great kickoff to our first series. And the last thing I just want to finish with, we always like to say at Impact, the more women we have, the more grants we're able to give and the more lives we can save. And Impact is just getting started with giving over 2 million so far. We think that number is going to be extremely high in the future, and we cannot wait to help more nonprofits and help our residents. And we really want to thank the Commissioner for all your work in bringing all these needs together and all the services and helping everyone. And I hope everyone has a wonderful night, and we'll see you on the next call. Thanks, everybody.
Thank you. Bye.
Lori, if I can please tell Susan, I'm Annette that wrote that question. It's the reentry program, Susan, that's located in Monmouth County, Neptune City, which is where I work with, and also Ocean. I work with all of them, but that's the program that I was mentioned in about the housing. Thank you so much.